So the challenges, there are many that we need actually to address in order for us to be able to recognize the full potential of the technology. So some of these challenges come from reproducibility of the results. So we've seen models that can be applied to a healthcare system, let's say build on a healthcare system. The question, can that apply to other healthcare systems? Can it be applied broadly? Like if a model, let's say, built in the United States, can it be applied in Europe and it's a different patient population? So I think reproducibility is extremely important, and we don't see, actually a lot of algorithms sometimes behave better on their own data, but behave bad on separate or external data. So reproducibility is very important. Another important one is explainability. Can we explain the output of the model? And that's extremely important in healthcare, because in other industry, like let's say in Google, when you Google, really Google doesn't need to explain how they come up with the result to you. But in healthcare it's different, because now if the model is suggesting something to me and I'm acting on it as a physician, now I'm altering patient life. I have an impact on patient outcome, and that can be dangerous. So understanding how the model operates, understanding the variables that the model is chewing on, becomes really important for us as physicians to trust the model and then learn from the model on what's important for the AI system. The other thing is bias and fairness. So we've seen biased models. So is the model biased toward the patient? Is the model biased toward a prediction? And we have actually bias in the data. So we have seen models built on biased data. So is your data representative of the entire population? Do you have enough mix of ethnicity in your data? So if you build a model on white patients, can you apply it on African American patients and so forth? So I think bias is very important. And then fairness. Do we discriminate of the model output, or the model output can discriminate among patients and prevent them from getting a treatment or so. So I think there's also concern from patients that some of the AI output could be discriminating, and there are many others that we could discuss.